Our last chapter, Chapter 13, Children with Physical Disabilities, Health Impairments, and Multiple Disabilities. In 1917, the first legislative action for individuals with physical disabilities was enacted. In 1935, Franklin Delano Roosevelt's Social Security Act enacted vocational rehabilitation programs. In 1968, the Architectural Barriers Act laid groundwork for the Americans with Disabilities Act. And so progress has been made in universal access, medical intervention, and improving technology. This has allowed individuals with disabilities, greater mobility, communication, and independent living. Disabilities recognized under the Individuals with Disabilities Education Act of 2004 include orthopedic impairments like cerebral palsy and amputations, traumatic brain injury, deaf blindness, multiple disabilities, and other health impairments like epilepsy, cystic fibrosis, hemophilia, and sickle cell anemia. In the physical disabilities category, there are a number of neuromotor impairments like cerebral palsy, neural tube defects, seizure disorders, and traumatic brain injury. Degenerative diseases include muscular dystrophy, orthopedic and musculoskeletal disorders like juvenile arthritis, and spinal curvatures. Okay, so focusing on some of these individually, cerebral palsy affects the brain and body movement and can be caused before birth or from an accident or injury. There are several classifications, and you can see a pictorial depiction of this on page 425. There's a spastic classification, which is tight muscles and stiff movement. There's a dyskinetic, where the whole body has tonal abnormalities with constant changes, and the ataxic, voluntary movement involving balance is abnormal, and then there is a mixed classification. So body regions that are affected. The hemiplegic is just one side of the body. Diplegic involves the whole body but legs more than arms, and quadriplegic is equal distribution across the body. Seizure disorder. This is an abnormal electrical discharge within the brain that disrupts normal brain functioning. Symptomatic of an underlying problem that requires medical evaluation. In order to prevent injuries, we need to loosen clothing around the neck, put a pillow under the head, roll the individual on one side to prevent choking, and reassure them when they wake up and help them change their clothes. Seizures lasting more than 5 minutes or repeated seizures require medical assistance. There are also something called absence seizures or petit mal seizures that may last only 10 to 30 seconds, and really many times they go unnoticed because it's kind of like you're just daydreaming. Asthma is an immune system allergy disease. It causes bronchial swelling and swollen lungs, difficulty breathing, and triggers could be pollen, dander, exercise, or anxiety. Acquired immune deficiency syndrome, or AIDS. This is caused by the human immunodeficiency virus, HIV. You can carry HIV and infect others for 10 or more years without actually developing AIDS. And a mother who has AIDS can infect a fetus. This compromises an individual's immune system. So something to keep in mind as far as prevention would be universal protection precautions, wearing gloves when dealing with body fluids like blood, urine, fecal matter, vomit, and mucus. Practice gloving when removing gloves, so making sure that you're not touching the outside of the glove when you remove it. Make sure you properly wash your hands even when you wear gloves, and after you've taken them off, wash them just as vigorously as you would if you hadn't had gloves on. So make sure you make lots of bubbles and rub a lot. Use the hottest water you can stand, and turn off the faucet and dry with a paper towel, and dry your hands with a paper towel. Wash all surfaces with soap and water. Towel for 10 to 30 seconds. Rinse with warm water and then spray with bleach. So some guidelines for teachers is to learn about the children in your classroom's diagnosis and the impact of that. Learn about medical treatments and side effects. Learn about other support systems. Expect extensive absences and plan to assist them in catching up. Recognize medical difficulty and be prepared to address that, and then be prepared for medical emergencies. For severe and multiple disabilities, this is defined as those who require extensive ongoing support in more than one major life activity in order to participate in integrated community settings and enjoy the quality of life available to people with few or no disabilities. This includes a broad range of people, including those with psychiatric disorders, deaf blindness, and combinations of health, motor, or cognitive impairments. Here we have a table that lets us see percentages, disability distribution for children ages 6 to 21 who receive special education and related services. And this is from fall 2007. And so you can see the largest category is the other health impairments category, but they are small percentages in the population that receives special services. So genetic factors and disabilities. Some that have genetic components include muscular dystrophy, sickle cell anemia, hemophilia, cystic fibrosis, and juvenile diabetes. Gene replacement therapy is one area of research searching for treatments for these disorders. So in regards to assessment, identification of children with physical disabilities and health impairments is usually done by a physician. As far as educational assessments, normed reference tests are not an adequate measure of the true abilities of many students with disabilities. The law requires educational assessments to be timely, comprehensive, and multidisciplinary, and accommodations for or alternatives to assessments will be included in a student's IEP. So motor skills and mobility, it's important for upright postures for sitting, standing and upright postures for assisted ambulation, such as braces and crutches, And then functional movement like reaching and grasping, arm movements and fine motor skills, and moving around the environment, making them as close to typical as possible. Educational responses can be achieved with assistive technology. For it to be effective, it must be selected with the child's needs in mind, and the child must receive training on how to use this technology. It could be high-tech, like electronic boards for speech assistance. It could be low-tech, like splints that allow students to hold a pencil. Or it could be certain devices and applications. And some examples are on page 443. And then finally, life skills by age, as far as what you might expect or what kinds of skills need to be focused on, you can find on page 441 to 442. So lifespan issues, the family support is key. Families need to be both emotionally and physically supported. And the transition to adulthood is made easier with careful planning. A transition coordinator assists in developing the ITP with plans for either vocational placement or post-secondary education.